Hey, Dr. Lindsey and Wendy here. This is a 364-day update on a repair case on a guy roughly my age who's been sprinkling a little bit of hair all over his head with various and sundry doctors for the past 15 years. And he's a pretty cool guy. He's got an outdoor job. He wears this long flowing mane, but he came in and his complaint was his right up the middle just didn't have much hair. And sure enough, he just didn't have much, right, Wendy?
No.
And he tells you in the little video that comes up that he's had 3 previous hair transplants by other guys. And what happens typically is if you have a little hair sprinkled all over your head, there are 4 issues. First of all, if the doctor doesn't trim you down, the doctor can't see to make the holes dense enough to give you a good result once all those existing hairs go away from male pattern baldness. Second is
the technician can't see.
Wendy and Celesta and Stephanie can't see the holes. Third is when they're trying to put the hair in, sometimes they get hair stuck underneath the new grafts going in, and that of course pulls out the graft. And fourth, sometime during the first couple of days, the surrounding hair sticks to the new grafts and pulls them out. And so it just never works out. And so you end up looking good for a little while and then needing more and more done. And so this guy's done 3 surgeries before he got here, and this is how we repaired these guys. So here he is beforehand with showing the area we're going to put the hair in. And notice it's a finite area right up the middle. And we don't go right to the edge. He was a little scared to go right to the edge. They're always worried that it's not going to work, even though this was a little thin last year. So we went right up the center of his head and trimmed him down. And now you can see the arrows marking the darker hairs, which are grafts he's paid for elsewhere. The rest of those hairs are just miniaturized hairs that are going to go away, right, Wendy?
That's just natural hair, right?
Yeah. And so years ago, when those things were still thicker,
that's where his hair looked good.
Yeah, he looked good after his first, second, and third transplants for a while, and then those hairs miniaturized and some of them went away. So
yeah, that's what I hear when patients come in your consultation room there. They'd say, it looked great sometime, but now it's starting to fall out.
Not from us, from other
people. But it's not the transplanter hair that's going away. It's the natural hair that they had that goes away, and it makes the hair transplant that looks like it didn't work.
Exactly.
But it's not like that, right?
Exactly. So now so once he's trimmed down, then I can use my fancy magnifying glasses and make holes as closely as I can, as shown in this picture, to the hairs that he's already paid for, trying not to hit any of the roots. But nevertheless, at about a month out, the hairs we put in and the hairs that he's got there are going to go into a rest cycle. So they're going to go away at a month whether you trim them or not, so you might as well trim them down and get a good hair transplant. So here he is after Wendy and Stephanie placed the hair, and that's pretty well packed in there, right, Wendy?
It is, yeah.
And so what that white stuff is, here, for example, is a 2-hair graft or a 2-stalked crepe myrtle tree, which are common in Virginia. And you put either one of them down into the soil or the scalp is right here. So most of the root of either the tree or the hair is down below the surface, but on trees you leave a little bit up so the water doesn't rot the stalk here, the trunk. And with hair you don't want to bury that skin and cause cysts. So that white stuff is just this little bit of dermis that you see sticking up. The meat is really way down in the scalp. So this is at the end of the case. And he did great. He went away. He's got this outdoorsy job on the shore, and he just came in the other day. He's 364 days out, and he looks awesome.
He looks great.
And it takes typically 15 or 16 months for these repair cases, but he already looks good because he's got this kind of wild mane of hair. And so he noted in his pictures that we didn't fix here, he'd like that fixed, and now his part line he'd like to work on. So we're going to hit that in January. But take a look at his little video. You are 364 days out from us working up your part line. When do you comb that stuff there?
The middle.
Right.
Yeah. Can you put your head down a little bit? Perfect.
Yeah, that's pretty
good.
Good.
This is ours right here.
That is good. And you were just commenting that it's starting to thin again
on the front and on the part side.
And so what Wendy and I were just telling you is that when you
right there,
when you go to a hair guy and they place around existing hair, first of all, they never get it dense enough, but then you look good for a little while, but then the hair that was destined to go away goes away, and you think it didn't.
And then you look like
yeah,
this.
Right.
Yeah. So not like that mop, pulling that mop, Wendy.
Like this.
Yeah.
Yeah, that's what's happened.
It shows really we can get a pretty good thick result, even at 12 months in these repair cases, if you just pack it tight enough. And you were talking before about if you would have just done it once or twice rather than 4 times, you would have saved a lot of money and a lot of misery.
But yeah, but like you always say, the guys that don't want to shave, they think that they can get away with doing it one time and doing it right, but then he has had 4 times, 3 times done somewhere else, and the last time we did it to fix this, so he basically didn't gain anything from just doing a hair transplant, placing in between
With the other guys.
with the other guys, because we still had to shave them.
So do your research. If we can help you, give us a call. We've got 220 videos up on YouTube explaining all this stuff in detail.
Yeah.
Take a look, and if it doesn't make sense to you, and you're still interested, come in and we'll explain it to you and show you what we can do.
Yeah, he can explain to you with pictures what could happen if you do it one way.
If you do it the right way or the wrong way. So thanks for watching, and take care.